Thank you, Dr. Raman. Good afternoon, everyone. Honorable Minister, Dr. Thomas, other distinguished members on the dais and in the audience, and the very patient, large gathering which is present here. The context has been set by all my previous speakers, and we all know that Kerala is a front runner, and in all other states we look up to Kerala, the Kerala model of decentralized development, of panchayat level development. And so what is it that Kerala needs to do a little more to become the model? I wouldn't say just hunger-free state, but like Madhura Swaminathan said, move from food security to nutrition security, to become malnutrition-free Kerala by 2030. So in that context, I just wanted to dwell on or look at where Kerala is today in the context of, Professor Swaminathan has been mentioned here, and so he chaired the National Commission on Farmers, which is popularly referred to as the Swaminathan Commission. So in that, the Swaminathan Commission, one of the terms of reference was a strategy for food and nutrition security. And next slide, please. So I would refer to that in terms of, Professor Swaminathan was one of the first to call for looking at both food and talking about both food security and nutrition security simultaneously. And this is the definition which is there in the National Commission on Farmers in terms of, we talk about availability, access, and the affordability, the absorption part, the need for safe drinking water, sanitation, hygiene, and as well as the environmental sustainability of the food that is produced. So it's a very comprehensive definition. There is this chapter in the final report of the National Commission on Farmers. I worked there as officer on special duty. And so the chapter is titled Making Hunger History. And following this comprehensive definition, a 6-point action plan is given. The next slide, please. Where the call is for having a life cycle approach to food and nutrition security, addressing the needs of each of the age groups, a diversified food basket, addressing the needs of migrant populations. There's a huge, the rural-urban migration, internal state migration is there, interstate migration is there. How do you address and ensure that the needs of all vulnerable people are met? The second is in terms of the community food security system. So having the decentralized approach. So there are again examples. As I was looking at this, I was trying to relate with examples within Kerala. So what you had in during COVID, the community food kitchens, the Subiksham restaurants that Mr. Venkatraman mentioned. So these are the initiatives because Kerala has been again a forerunner in panchayat level empowerment and development. Professor Swaminathan would often refer to the 73rd Amendment Act and for the devolution of powers to the grassroots level and have it led from the grassroots level. The eradication of hidden hunger, a major challenge here in spite of Kerala being a forerunner in all the other nutrition indicators, anemia levels are still high, as was mentioned by some of the previous speakers, Dr. Sharma in her presentation as well. About 40% of children are still affected by anemia as per the latest National Family Health Survey, as well as around a third of adolescent and teenage girls. So that's an important area to address. So the need for food fortification approach is what the Commission emphasized. So food-based approach, how do you ensure, which is where the nutrition awareness component becomes important, and how do you ensure that the food you eat, the diversified food basket that Mr. Mehboob just called for, and so anemia is largely to consume iron-rich food. And then at the same time to know what we found, to cite an example, is in Vardha, when we did a field level study, we found that the iron intake was good, but the anemia levels were high. So anemia was not being absorbed into the body. They need to take vitamin C as well to ensure that the iron gets absorbed. So the nutrition awareness becomes very important in this. New Deal for self-employed. Again, in Kerala, there are these the Kudumbashri example is known internationally and it is looked up to. So the promotion of non-farm enterprises, the community farming, group farming enterprises and initiatives, and how the importance given to promotion of education, health, public health care, those again become very, very important. Production and profitability of small holding, sustainable production system. The Subiksha Keralam is the initiative that is underway, and how do you make that more effective? More, again, going back to what Mr. Mahbub said, to go back to what the diversified food basket that used to be there, and how to ensure that that happens, more of vegetable production, more of local level production. And the Food Guarantee Act, we already have it, and it's underway, as Dr. Thomas explained in detail. So in this context, there is a lot which is already happening in Kerala. You just need to see how to tweak it to work better. Next slide, please. And the global context, which Professor Glenning referred to, the food systems, the need for a food systems approach, sustainable food systems. In 2021, the UN Secretary General convened the United Nations Food System Summit, where all countries, including India, participated. And these are the 5 action areas which were delineated in terms of nourish all people. So in the Kerala context, Sampushta Keralam, to ensure that everyone, including the last person, the vulnerable person, everyone is addressed. Again, the initiatives which are there, the example that was mentioned about these mobile ration shops and the private-public partnership with the auto rickshaw drivers delivering it. Those are like novel innovations which need to be strengthened and ensure that you reach out, so addressing the needs of migrant populations. Nature-based solutions. So again, under Subiksha Keralam, how do you ensure that it is more both environmentally, done in an environmentally sustainable manner? And that links to building resilience to vulnerabilities. And Kerala is also very climate vulnerable. So how to enhance the climate resilience to have more stress-tolerant varieties of rice? How to ensure that, again, in terms of nourish all people, this morning at breakfast I met the scientist from Indian Rice Research Institute who is participating in the agriculture session. So she was talking about biofortified rice varieties. How do we have governance or a policy initiative to promote biofortified rice varieties to address malnutrition issues? And advancing equitable livelihoods and decent work, empowered communities. So it is in this context that I would submit that we should look at moving towards malnutrition-free Kerala. Next slide, please. And this is my last slide. In terms of the need to focus on the first 1,000 days. It said that it is within the first 2 years of the child, from the time of conception, that the maximum brain development in the child happens. And this is an area that we could look at focusing on. Of course, maternal and infant mortality rates in Kerala are much lower than the national average and as compared to other states. But if you look at, say, for instance, complementary feeding, again, as per the National Family Health Survey, less than a quarter of infants 6 to 23 months received an adequate diet. So that's an area to focus on. Similarly, anemia among pregnant and lactating women, among adolescent girls, those are important trust areas I would like to flag. Nutrition awareness, Dr. Madhura Swaminathan spoke about nutrition awareness starting with schools. I would say it has to be across the board, starting from families, schools, colleges, youths, a lot of the youngsters here. How many of us understand the importance of having a balanced diet and healthy diet? And so in the working group, when I was working with Dr. Raman, we used to discuss how do you work on this nutrition awareness. It can be through posters in all these public distribution system, the fair price shops, in public health centers. Across the board, how do you make nutrition a much talked about and understood term? Professor Swaminathan used to repeatedly emphasize the need for nutrition-sensitive agriculture. Having a farming system for nutrition approach is what the term he coined. You look at the malnutrition problem in an area and devise the farming system to address it. through whatever, will be through crops, through livestock, through fisheries. How do you address the malnutrition issues? So which then, brings in the importance of these decentralized, climate resilient and local value chains. So during COVID, with the lockdown, the importance of local value chains was what really came up. But once COVID went, it again came back to business as usual. But I think we should go back to emphasizing this importance of local value chains, re-engineering and giving more thrust to local level production and initiatives, because that is what is going to matter as we go forward, reduce carbon emissions, reduce carbon footprints, and move towards a malnutrition-free Kerala. Attention to food safety is equally important for healthy diets, as well as reducing food loss and food waste. It is estimated that globally in India, about 30 to 40% food gets lost at the post-harvest stage. So that's one important area to look at, where, again, under Haritam Keralam, possibly there could be initiatives that could be taken around the 4 R's of reduce, recycle, recover, and reuse. How do we make it, how do we develop a strategy for reducing food loss and waste? Food waste happens at the consumer end. So the food system is from the producer to the consumer. Food waste is when at the family and community level, and in hotels and restaurants, how do we ensure that the food waste is reduced at that level? That again is going to be very important as Kerala plans to move towards from hunger-free to malnutrition-free Kerala and set a benchmark for India and the globe to follow by 2030. And I'm sure that with the desired political will, it also calls for, a food systems approach calls for close interministerial working. Food security is not just the domain of the Ministry of Food, but all the relevant ministries need to come together and work together for making Kerala malnutrition free. And all of us also have an important role in making this happen. So with that, I thank the organizers for the opportunity. Thank you all.